set up to have the basic exercise. So for the knee exercises, these are things we could possibly do post-op, but I was just thinking, what are the things that you could do in clinic that could help these patients before they see us, 40, 45 days later, hopefully sooner. But so the first one is the quad set. So I'm going to bring it up here so you can see. So for this one, a lot of the patients that have maybe mild or advanced arthritis have kept their knee in a flexed position, so it's more open packed and it's less painful. So I want to see if they are even able to get extension, and if they can, if they're able to contract the quad. So in the clinic, I'd have the patient basically just press their knee down straight and see if they can get that quad contraction. Sometimes they're not able to, and I have to kind of differentiate whether it's because they have pain that's inhibiting the muscle, or are they just kind of worried that it's going to be painful. So one of the tricks that we use is to have the non-involved side, if they do have a non-involved side, go into that quad contraction. So sometimes if this one's working, they can kind of start to work on the other side and can get it to contract better. So usually something like 5 seconds for a hold, and then doing that about 15 times. And I'll have them do that 2 to 3 times a day just to get that quad going. Especially post-operatively, swelling and pain, the quad is inhibited. So this is an exercise that they can start generally right after surgery. So if they're able to do that, then we kind of progress to the leg raise, straight leg raise, and see if they can hold the quad against gravity. So the left side or the involved side, I have them do their quad set, and then bring the leg up, try to tap my hand. So what you're watching for is, are they able to keep that completely straight the whole time? If they actually have a slight bend and a quad lag, they're not ready for this exercise yet. So come all the way down. So if the calf is touching first, then the leg is actually straight enough. So go ahead and do like 3 without. So basically that's how the exercise should look. When they have a slight quad lag, which is a couple quad lag, you're going to get the heel touching you before the calf muscle. So in that case, go ahead and sit up. We would do something like the long arc quad, where they could sit in the chair and then just basically straighten the leg against gravity and then come back down. And you can do a 3 to 5 second hold with that exercise. So those are all non-weight bearing. That's where I would start, especially with someone that has a lot of knee pain. If they're doing pretty well and they just have moderate pain, you can go into more of a standing quad set. So in this case, you would have them shift on to, let's say it's the left knee. They're able to do the quad set, you've already checked that out, and then work on extension with loading. So if she can do that, you basically, and they can do this actually against the wall also, so kind of having that feedback to press into the wall or into the hand. And this is just more functional, again, leading back to the gait. If they have that slight bend that they've been kind of walking with, this is where we practice using that terminal extension that they do have when they're walking, and they're not keeping that knee bent, so that when they're walking it's a little more fluid and less antalgic. And then the last one, this goes for both the hip and the knee, would be the mini squats. So all of our patients are getting in and out of bed, in and out of chairs, on and off the toilet. So the big one is pain with that. So that squatting position. And what you see a lot of the time is when you have the patient squat, go ahead and squat for me, they'll have their knees kind of go into a valgus position, and they'll also be weight bearing through the front of the foot, and their knees will go in front of the foot, which puts a lot of stress on the kneecaps. So what we kind of teach them, I'll come around this side. There. I'll usually use a cane or a stick just so they can see, but to put more weight in the heels, so they get the center mass back, stick the bottom back, and then squat down from there so that the knees stay in back of the toes.
So if I did it the original way, I would just bump into the cane.
Yeah, so that gives them a little feedback. And trying to keep the knees apart. So that alignment is just a lot easier on the knee, and a lot of the time that will actually decrease the pain that they're getting.
It's terrible.
So they can practice this at a counter just to be safe, or I would have them put a chair in back of them because it was a little bit strange to weight bear through the heels at first. So we don't want any accidents. So that's kind of the gist of it for the knee.